How many people would be able to give themselves 2 shots a day or sometimes more? Well, if you had diabetes, you may have to learn. Today I'm here to inform you about diabetes. I wanted to give you more details to help you better understand what it is, what causes it, and how your life will be changed if you're diagnosed with it. Diabetes is serious and deadly. It is the leading cause of kidney failure, non-traumatic, lower limb amputations, and in new cases, blindness has been discovered. Diabetes is the major cause of heart disease and stroke. Diabetes is the 7th leading cause of death in the United States. Diabetes. What it is. What diabetes means, it means you have too much glucose in your blood. Glucose is a form of sugar your body uses for energy. It has some glucose in it, but too much in your blood can damage your body over time. So there's 2 types of diabetes. There's type 1 and type 2. Type 1 diabetes is previously called insulin-dependent diabetes or juvenile onset diabetes. It develops when the body's immune system destroys pancreatic beta cells, the only cells in the body that make the hormone insulin, and then it regulates the blood glucose. People with type 1 diabetes must have insulin delivered by injection or a pump daily. This form of diabetes usually strikes in children and young adults, although it can be developed at any age. The most common risk factors for this type may be genetic or environmental, depending where you live. There's been no known way to prevent type 1 diabetes, it just develops. Now there's type 2 diabetes, and this is the most common. Diabetes type 2 is associated with older age, obesity, family history of diabetes, or a history of gestational diabetes, or physical inactivity, and race. Race is a factor for diabetes among African Americans, Hispanic, American Indians, and some Asians. Type 2 diabetes in children and adolescents is very common with these type of races. Diabetes can cause heart attacks, stroke, blindness, kidney failure, and other serious health problems. But you can prevent these health problems by keeping your blood glucose, keeping your blood pressure under control, and watching out for your cholesterol. Now that you know what diabetes is, there are several ways to prevent it. Make wise food choices. Choose fruits, vegetables, whole grains, fish, lean meats, low-fat dairy products. Learn what to eat and how much to have. Be physically active for 30 to 60 minutes every day. For example, just take a walk each day. Once you reach your healthy weight, to maintain it, you watch what you eat by your food choices and keep yourself active so that you can maintain that weight. Take your medications as prescribed and keep taking them even after you've reached all your targets so everything stays under control. Ask your doctor if you should take aspirin to prevent heart attack or stroke. If you smoke, quit. These are all things that will help you to not get type 2 diabetes. Just a few facts on diabetes that I'm not sure people realize. Diabetes affects 25.8 million people of all ages. There are 18.8 million people diagnosed in the United States, but there are still 7 million that are undiagnosed, meaning they don't even know that they have the disease. In this speech, I have explored the key factors that cause diabetes, how it affects minorities especially. My husband and my aunt have diabetes, and I have learned through this research that it's something that can affect the whole entire family. Diabetes is an epidemic in the United States, mainly because of bad eating habits and lack of exercise. It's starting to affect young people, our children, where it used to be more common in older people. We only have one body, and we all need to do our best to take care of ourselves, and thank you.